Hi everyone, this is Randy Neiswonger. Welcome back to this episode of Community Beat. Today I am here with Mary Puntillo. Hi Mary,
Hi.
Good to see you.
Good to see you, thank you.
Thank you so much for joining me today
My
on
pleasure.
Community Beat.
My pleasure.
This month I understand is Sleep Safety Awareness Month, and SIDS Awareness Month as well.
Yes.
And I was hoping to get a little bit better understanding of what exactly is Sleep Safety Awareness and SIDS Awareness Month.
So what we try to do during this month of October is send out a huge message, a complete blitz of how babies should sleep, because it's all about that safe environment when they're sleeping. We try to make sure that not only the parent knows, but also the grandparent, and in fact the whole community is aware of all those safety measures. Babies should not die because of where they're sleeping. That should not happen. And unfortunately, that is a situation that we see nationwide and specifically in our neck of the woods, right here in Northwest Indiana.
That's really scary, and I think education around that is so paramount for these young parents that are, really concerned and aware of those type of habits that can be detrimental in unfortunate situations. So there's a hashtag going around social media, sleep awareness, around sleep awareness. Can you tell me a little bit about that?
So there's a hashtag clearthecrib, and what it's meant to do is that families get a look at those cribs and they clear out all the extra stuff. The only thing that should be in a baby's sleep environment is that sweet little baby. No other extra linens or bulb syringes or diapers or anything like that. Just the baby. That is the safest place. So that hashtag is just trying to get people, kind of spunked up and ready to send that same message.
I'll tell you, as a parent myself, you're teaching me things that I never thought of. We always want to put our babies to bed with a little stuffed animal or something like that to make the scene look comfortable and inviting and those type of things. But what I heard is that that's not necessarily a good habit to get into.
No, and we as parents want to do the right thing for them, and doing those sort of things are actually very dangerous.
Indeed. So, coming from a knowledge deficit standpoint, like I just shared with you, what type of resources do parents have to gain access to this valuable information?
Well, of course, there's always the American Academy of Pediatrics. They have information on their website, aap.org. And then there's the National Institute of Child Health and Human Development, NICHD, has a wonderful supply of information, a wealth of information that's available. We also provide classes, our Taking Care of Baby class, our grandparent class, our childbirth classes, where we share all that cutting edge information. Just to make sure that our young families are well aware, as well as their parents and grandparents are well aware of how a baby should safely sleep. We like to always remember our ABCs. That's how easy it is. That baby should be A, alone, B, on their back, always start to sleep on their back, C, in a safety approved crib. But then we like to kick it up a notch to D, E, and F. Dressed in the halo sleeper, or the blanket sleeper. D, dressed, E, empty crib, so nothing in the crib, and F, firm and flat, that sleep surface should be flat.
Wonderful. I'm going to pivot on you a little bit too.
Okay.
My understanding is that you're a 30-year employee of ours here at Community Hospital.
Actually, believe it or not, 40 years. Can you believe
40
it?
years.
I
My
was
gosh.
5 years old when I started.
I was going to say you couldn't have been much more than
I
that.
wasn't.
You were probably learning these techniques when you were
At that time, right.
At that time, absolutely.
Right, I can't, yes.
So tell me, what is the secret sauce? What is the glue that has kept you here for all of these years since you were a young nurse?
Yeah, so I honestly, when I moved back up to this area, I came from a med center. And when I came back into this area, I gravitated towards other med centers. And in fact, I had a job up at one of the med centers. And I was all ready to get started. And my life kind of took a whole turn. And here I am. I landed up at Community Hospital. This was just going to be just a stint. It was just something to do in the meantime. I wasn't going to stay. Here I am, 40 years later. And actually, the thing that kept me here was pretty much the people I work with. That is it in a nutshell.
That is wonderful. And you know what an amazing testament to yourself and your career and the legacy that you've not only brought here, but will continue to carry on for years to come and generations to come, hopefully, ideally. Any words of advice for folks that are coming into the organization on how to assimilate this in similar fashion that you did?
Oh, I would say do it. For one, it's
Okay.
a question in their mind. Do it. And also just always learn. Never stop learning. Here I am 40 years later. I'm still learning. There's always something that's out there. And to always be there for that other person as well. That's one thing that I've loved so much about the area I work in. We are a family. We work tight. We work not only with our hands and our mind, but with our heart and for each other. So just sharing that within their unit and, again, working together.
Mary, I can't tell you how grateful I am. Learning is so important, but also sharing your knowledge that you've
Yes.
gained over the years. And I appreciate you imparting that knowledge onto me. I learned something today, and I'm very grateful for that.
Well,
thank you so much for joining me on Community
Thank
Beat.
you.
It was wonderful to
Thank
learn
you.
a little bit and get aware of sleep awareness.
And appreciate the opportunity.
Of course,
Thank
thank you.